Hey, it's Dr. Dan today, and I'm going to talk about the difference between what we consider mainstream medicine and holistic, or I even hate to say it, but alternative medicine. And this actually goes way back to something called the Flexner Report. You can look it up. It's quite an interesting history there. Abraham Flexner was given a lot of money by an industrialist. I won't say his name because sometimes even just saying his name can get you some strikes on social media platforms, especially if you're speaking ill of him. And anyway, the Flexner Report basically was a tool that was utilized to shut down a bunch of alternative medical schools. So basically, if you didn't prescribe drugs and you didn't follow the allopathic model, you were going to be shut down. It was a very organized effort, and it was successful for the most part. A few types of practices escaped, osteopaths, but they later got absorbed into medicine, so there aren't really any true osteopaths left. NDs, naturopathic doctors, remain independent, and of course chiropractors, which I fall in that group. I'm also a physical therapist as well, but I was a chiropractor first, and that really gave me the foundation for my philosophy as far as my practice goes. And as far as philosophies for medicine, the philosophy is diagnose and treat. So we look at a patient, not even really look at a patient, look at the labs of a patient, and then prescribe medicines to kind of bring those numbers back into normal ranges. And that may work in terms of maybe short-term stopping problems, but long-term it's not really a solution, it's more of a Band-Aid. And we know that many medications, I've done multiple videos on statins, there's more and more research coming out about statins. Just read a report today that talked about statins actually being pulled from like a mycotoxin. This is a mold. Mold is incredibly bad for us, and specifically ochratoxin, I believe it was B. I'll have to look back again. But bottom line is the amount of ochratoxin within the statin drug itself for the 80 milligram Lipitor was over double the toxic rate. And toxic rate is something that means that it stops cellular function, it stops cellular regeneration, causes cell apoptosis, which is a fancy way of saying cell death, all kinds of crazy things. And so it's very interesting that especially chiropractors have been labeled quacks by the mainstream, and yet the people that are giving drugs that have incredibly dangerous and harmful side effects are the ones that are A-okay. And there's a reason behind that. I won't go into that now. It really doesn't matter as far as this video goes. The reason why I'm, again, putting the video out is because our paradigm or our philosophy at our office isn't diagnose and treat. I don't want to diagnose somebody and treat somebody. I want to heal and then prevent. Those are the two things I'm really interested in. I want to find out what's causing the problems. I want to remove those problems, whether it's behavioral or supplemental or whatever it is, and then which allows the body the ability to heal, and then give the patient the tools they need so that they can prevent a relapse or a recurrence. And really that comes back to that whole model where the patient becomes responsible for their health again. I'm happy to be part of the team, but at the end of the day, I only spend a little bit of time with each patient who comes in the office. Every one of you spends 24/7 with yourself. So who better to guide your care, your treatment, and to make sure that you're on the right track? And a large part of that inability to do that for yourselves right now has been because you've either A, been getting bad information, or B, no information at all on what you really should be doing. And some research is good, some research is bad. You really do have to look at who's paying for the research, because that makes a difference. So you have to be careful and discerning and find people that you can trust, or even go to friends and be thorough in your evaluation and investigation of your problems, because again, at the end of the day, nobody should care more about you than you. I care very deeply about my patients, and my patients, of course, should be very invested in their health and well-being. I can't care more for them than they care for themselves. It's a two-sided coin, and everybody has to work together to get that result. I can have all the knowledge in the world and all the supplements and all the programs and protocols to help somebody get healed, but unless they're willing to implement them, there will be no effect, or no successful effect or outcome. And again, this all comes back to the difference between the models: diagnose and treat, heal and prevent. Diagnose and treat, so, here, just take a pill. Magically, everything's fine. You don't have to think about it. You don't have to change what you're doing. You don't have to alter your behaviors. You don't have to take better care of yourself. You can just take a pill and forget about it. That's not a winning combination. And I was actually just looking at a chart that showed age groups and percentage of people on medication. And the early 20s groups, so it was between 20 and 23, about 23 points, I think it was 23.7% of the population in that age group was on medications. And then when you went to 75 plus, it was over 75%, 76%. So you see this progression from 25% of the people taking medications in the early 20s, which is way too high. Those people are healthy. They should be healthy. They should be taking drugs. To when we get to the other end of the spectrum, 75 plus, 3/4 are taking medications. And the majority of those things can be rendered unnecessary by behavioral lifestyle changes. So I'm just here today to let you know that there are better ways than the standard allopathic model. We're here to help. It's time to quit being a victim. I hate to say that. I don't want to kind of point my finger in somebody's chest, but you've got to take responsibility. If you're serious about your health and you want to get well, in the end, it's up to you. I mean, there are plenty of people out there to guide you, I being one of them. So if you have questions, please let me know. If I'm not in your area, if I can't help you, I will certainly try and help you find somebody who can, okay? So let's move from diagnose and treat, which is basically just managing problems, to the other side where we can heal and prevent, so that we can live better, live longer, live healthier, live pain-free, live drug-free, all of those things that really indicate somebody's being healthy. Have a great day. Take care.